everyone, my name is Asana. I'm a student nurse for today. Is it okay if I do a head-to-toe assessment on you? Okay, for the purpose of this video, the patient is uncovered, bed rails are down, bed is at a comfortable position to work. But in clinical setting, patient will be provided for privacy, level safe position with at least 2 rails up. I'm going to begin by confirming the patient's name and date of birth against their ID band. Can you tell me your name and date of birth? Okay, upon the patient's response, I can state that the patient appears a stated age, facial expression is relaxed, behavior is calm, and no signs of distress. I can assess the patient's level of consciousness by asking, do you know what year it is? Do you know where you are? And do you know why you're here? Based off the information the patient has provided, I can state that the patient is alert and oriented ×4 to time, place, self, and situation. I can also state that the patient's basic speech is also good. Patient appears to have freshly showered, hair is groomed, so hygiene care has been performed. Prior to this assessment, I have taken a set of vitals and everything is within normal range. Moving on to the head and neck patient, I will inspect the patient's head shape and facial symmetry. I will also inspect the patient's scalp and hair distribution. Everything is within normal range. I will also inspect the patient's neck and shoulders for neck. Shoulders are even and symmetrical bilaterally, ensuring that the trachea and substernal notch are midline. I will also inspect the patient's face again and mouth, ensuring that everything is symmetrical, and that's it. I will begin to palpate the patient's head for any tenderness, masses, or any other abnormalities, splitting the hair into 3 different spots. I will then palpate the patient's carotid artery 1 at a time on the neck. For rate, rhythm, and force on the 2+ scale, everything is within normal range. I will now palpate the patient's lymph nodes, starting at the preauricular, postauricular, occipital, going down to post-cervical, anterior, cervical, tonsillar, submandibular, submental, and supraclavicular for any nodules or any other abnormalities, and everything is within normal range. I will move on to the patient's eyes, ensuring that eyebrows are even and symmetrical bilaterally. Eyelids are appropriate to patient's ethnicity. Eyelashes are full. I'm going to pull down the lower lid and show you that the conjunctiva is pink and moist, free of any lacrimal drainage, no lesions, and we're doing this bilaterally. I'm also going to assess patient's eyes for perla. Here I'm going to go if I didn't state this, for ensuring pupils are equal, round, and reactive to light, as well as accommodating. I'll instruct the patient to follow my pen light without moving their head. Patient is accommodating to light. I will also assess patient's extraauricular eye movements. I will have the patient follow my pen light without moving their head, and they will go. And everything is within normal range. I will move on to the patient's ears. Here I'll inspect the patient or assess the patient's auricle, lobial, and tragus. I will inspect the patient's ears bilaterally for any drainage and patency. I will also perform a hearing test on my patient, or a whisper test. I will stand to the patient's side and behind, having the patient occlude their ear. I'll give them 3 words like black, white, and blue, having the patient repeat these to me. Patient can repeat and is responding appropriately. Hearing is intact. We're doing this bilaterally. I will also move on to the patient's nose. We are going to assess the mucosa, or the mucous membranes. Here we're going to assess for patency. I'll instruct the patient to blow out of their nose for any flaring or any septal deviation, and my patient is free from any abnormalities. I will move on to the patient's mouth. Here I'm going to ensure that, well, here I can see that my patient's lips are are moist and intact. I will take a look inside my patient's mouth, looking at the gums, looking at the buccal and sublingual mucosa, ensuring uvula is midline, tonsils are present bilaterally, teeth are free from any decay, noting any use of dentures, and free of loose teeth. But I mentioned this, we're also looking at the patient's gums. Everything is pink, moist, and intact. We are now going to move down to the patient's cardiovascular assessment. We're going to inspect the patient's mode of breathing, whether the patient breathes through their nose or their mouth. We are also going to assess the patient to see if there are any use of accessory muscles or retractions. Also going to note how well the patient breathes in a supine, prone, and upright position. My patient is able to breathe in all three different changes of position. We're also going to inspect the chest for symmetry and shape. Also noting if my patient has a cough or any sputum production. I will begin by continue with palpating my patient's chest area. If I didn't mention this, sorry, going back to the neck, I am palpating the carotid arteries, both sides bilaterally for rate, rhythm, and force in a 2+ scale. But moving back down to the chest, here I am going to palpate my patient's 5 cardiac landmarks on the second intercostal space to the right side of the mid-sternal border. Here for aortic, for second intercostal space on the left side, close to the mid-sternal border for pulmonic. Third intercostal staying close to left mid-sternal border for herbs. Fourth intercostal space for tricuspid, and then the mitral on the fifth intercostal space on the left side for any heaves or lifts, and my patient is free from any abnormalities. I am also going to palpate my patient's upper and lower extremities with the back of my hands. The patient's skin is warm and dry on the upper and lower extremities bilaterally. I am also going to palpate my patient's peripheral pulses, starting at the radial for close it down for rate, rhythm, and force on a 2+. We're going down to the femoral close to the groin for rate, rhythm, and force on a 2+ scale. Going down to popliteal for rate, rhythm, and force on a 2+. Redoing this bilaterally. Moving down to the pedal pulses for rate, rhythm, and force on a 2+ scale, and bilaterally. Posterior tibial pulses on for rate, rhythm, and force on a 2+ scale, and my patient's pulses are within normal range. I'm also going to auscultate my patient's 5 cardiac landmarks, starting at the, again, second intercostal space for aortic, close to the mid-sternal border. Second intercostal space on the left side for pulmonic. Third intercostal space, staying close to the mid-sternal border for herbs. Fourth intercostal space for tricuspid, close to the mid-sternal border. We're gonna go mid subclavicular line over the nipple to the mitral. Here we're gonna listen for 60 seconds as it is the point of maximum impulse. Again, this is for the mitral. We're also going to auscultate my patient's lung sounds, starting above or right by the clavicular, going in a ladder pattern. Going second to the clavicular. 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Here, I will state that my patient's lung sounds are clear, free of any cracking, wheezing, or any other abnormalities. I will move on to the patient's abdomen. I will begin with inspecting the patient's abdomen for pigmentation, contour, color, evenly distributed on all 4 quadrants as it is present on my patient. Here we're gonna note any presence of petechiae, striae, bulges, masses, pulsations. I can also stand at the end of the bed, ensuring that the umbilicus is midline, and that is present in my patient. I will begin with auscultating my patient's bowel sounds, or my patient's bowels, going in a clockwise motion, starting at the right lower quad, right lower quad, right upper quadrant, left upper quad, left lower quad. Here I will then state that my patient's bowel sounds are active. I will then palpate my patient's abdomen on a same motion or same pattern, going right lower quad, right upper quad, left upper quad, left lower quad, noticing any bulges, masses, pulsations, or any tenderness, discomfort that my patient may have. I will move down to my patient's genitalia. Here I will assess the patient's the tissue, the color and health of the tissue, assess the patient for any abnormal discharge. I will also inspect the patient's color and characteristics of the urine and stool. My patient is free from any abnormalities. From here, we're going to move on to the musculoskeletal system. I can state that my patient's posture, mobility, and gait are within normal range. I will then posture, mobility, and within normal range. I've already stated that my for tremors, tics. We're assessing spasticity for tremors, tics, unevenness, or and symmetry. We're also going to state that my patient we've already said my patient doesn't use any assistive devices. Also going to inspect or have my patient perform the Romberg's test, where the patient will stand shoulder width apart, closing their eyes. I as a nurse will assess if the patient shows any swaying or loss of balance, as my patient is free from that. I will also assess the patient's skin for making sure that the skin is intact, free from any abrasions, lesions, or any other abnormalities. I will then any abnormalities, I will have the patient grip my fingers for strength test, having them squeeze as hard as they can, pushing and pulling against me. Patient shows equal strength up on the upper extremities bilaterally. I will also have the patient perform this test with their lower extremities, having them push against my hands, push up against my hands, and patient shows strength on lower extremities bilaterally. Going back to assessing the skin, we're going to assess for even color distribution appropriate to the patient's ethnicity, hair distribution, and any other abnormalities. I will have the patient also perform range of motion. Here I will have the patient flex, extend, supination, pronation, abduction, adduction, and circumduction. I will also pronation, abduction. I will also perform a sensation test on my patient. Here I'll use a gauze or a tongue depressor. I will gently scrape against my patient's skin with either tool. My patient will have their eyes closed while doing this exam. They will also state if they feel any sharpness or dullness and which extremity it is that they feel it on. My patient is responding appropriately. Before I end the exam, if I didn't mention this in the beginning, I would have the patient perform neck range of motion. I would have him turn his head left and right. I would have the patient flex, extend, hyperextend, having them push against resistance to my hand, going right and left. I would also have the patient try to touch their shoulder with their ear bilaterally. The patient shows equal range of motion of the neck. That concludes my assessment. I will bring the call light close, ask the patient if they need anything else from me, lower the bed to the lowest position, to the safest position, wash my hands, and that concludes my exam.